This conference will now be recorded.
Hi guys, welcome to my channel Medicine Ki Pathshala. This is Dr. Manali. So today I'll be talking about a very common head region disorder which every one of us have experienced many times in our lives, that is headache. Ache means pain. So in this video, I'll be talking about what is headache and its types, reasons behind a headache, and most importantly, which area of head is involved in what type of headache. All right, so let's get started. So what is headache? So a painful sensation in any part of the head is headache. Now, what are the parts of head? So there are four main parts of the head: frontal, temporal, occipital, and parietal, meaning above eyes, above ears, above neck, and crown of a head. So pain in any of these parts of the head is defined as headache. Now guys, headache is not a disease, वो कोई बीमारी नहीं है. But a disease could have headache as its symptom. कुछ कुछ ऐसी बीमारियां होती हैं जिसमें हेडेक एक साइन के रूप में दिखता है, एक सिम्टम के रूप में दिखता है. वो कौन सी बीमारियां हैं? We'll talk in this video. All right. Now, if I talk in a very simple language, then there are two types of ache. दो टाइप के पेन होते हैं. एक होता है शार्प पेन, एक होता है डल पेन. आज मेरा सिर बहुत जोर से दर्द कर रहा है, दैट इज शार्प पेन. आज मेरा सिर हल्के हल्के से दर्द कर रहा है, दैट इज डल पेन. ऑलराइट. नाउ लेट्स टॉक मेडिकली. थोड़ा और डिटेल में जाते हैं कि किस टाइप के हेडेक होते हैं, क्या रीजंस होते हैं हेडेक के. ऑलराइट. So to make it simple, I have just differentiated the types of headache in three parts. That is simple headache, throbbing headache, and severe headache. चलो एक के बाद एक टॉपिक को लेते हैं. Let's pick up first topic, that is simple headache. What is simple headache? So simple headache is nothing but tension headache, stress headache. ये stress की वजह से होता है. Stress could be of any type. It could be a simple tiredness, it could be emotional stress, or it could be a physical stress. Right now, because of the situation, because of the COVID situation, everyone, like most of us are working from home, right? So most of us are suffering from physical stress. Our lifestyle is not the same now, so we are suffering from emotional stress as well. और इतना काम कर रहे हैं पूरे दिन work from home में, so we are suffering from tiredness also. So simple headache is very much common in such situations. All right. Now what happens in this stress? What happens in this tension headache? So there is tightness of your neck and shoulder muscles. Because of it, these are the area of ache. ये typical area है pain के लिए. कौन से? एक तो forehead, जैसे मैंने बताया, above the eyes, frontal part, and this area, that is back of the head, that is nape of the neck. All right. So these two are the areas where the head aches. Why? Simply because of the tightening of the neck and shoulder muscles. अब neck और shoulder muscles क्यों tighten up हो जाती है? It could be because of overuse, it could be because of underuse, or because of simple weakness of the muscles. Fine. Now, what do we do to overcome this simple headache? Let's talk about that. So we can take simple measures. One can simply rest. Rest is something which is the simplest form which we can do. So उससे क्या होगा? जो भी हमारे tensed muscles हैं, that will get relieved. One can also apply soothing balm, जो कि pain relief balm होती है. Or one can go for massage. जो भी हमारे अंडर स्ट्रेस्ड जो भी मसल्स हैं, जैसे नेक मसल्स हैं, शोल्डर मसल्स हैं, अपने जो आर्म मसल्स हैं, इन सबको अगर हम हल्के से मसाज करेंगे, सो दिस विल अगेन हेल्प यू टू ओवरकम दिस हेडेक. ऑलराइट. So I'm sure you're clear with simple headache. Now let's talk about the second type of headache, that is throbbing headache. Throbbing मतलब beating, जोर जोर से मारना. Understood? So throbbing headache, very simple type of headache in throbbing is sinus headache. What is sinus? Sinus is a space in the bones of face and head that are connected to the nasal passages. All right. Can you see the picture here? Okay. So this is a typical area of ache in sinus headache, that is forehead, around the eyes and cheeks. Simply जहाँ पे हमारे sinuses होते हैं वहाँ पे pain होता है. All right. So this is sinus headache. All right. Now what you can do to overcome this? So the simple measures we can take is hot fermentation. यानी गरम hot packs जो हम लेते हैं उनकी सिकाई करना, that is hot fermentation. So इससे क्या होगा? It will improvise the circulation of the blood and जो blocked passages होंगे उनको भी open up करेंगे. We can also go with steam inhalation. What does steam do? Steam will open the passages in the nose and will help to reduce sinus pressure. One can also go with decongestants. What are they? These are the medicines that are used to help reduce the symptoms of sinusitis. Can you see a nasal spray here? This is what decongestant is. All right. So these three are the simple measures one can take to overcome throbbing pain. Now let's talk about the third and very important type of headache, that is severe headache. I'm sure you must have heard about this name migraine, about cluster headache. So let's talk about it. What is migraine? So migraine is a vascular headache. That is, it is associated with the changes in the blood flow in the head. In migraine, the person is unable to tolerate bright light and loud noise. He even complains of nausea, dizziness, and vomiting. All right. There are certain trigger factors in migraine. कुछ ऐसे reasons होते हैं जिसकी वजह से ये hit होता है. वो कौन से reasons होते हैं? Stress, insufficient sleep, excess alcohol, and use of contraceptive tablets. So this all is all about migraine. Now let's talk about cluster headache. See, people are very confused between these type of headaches. उनको समझ नहीं आता कि that is it a migraine or is it a cluster headache? All right. So let's talk about the the pattern of pain first. उससे I'll show you the difference. See, जो cluster headache है, can you see the picture here? Migraine की. So जो migraine headache है, उसमें the pain would be on one side of the head involving the face यहाँ पे, or it would be on the both sides of the head. Wherein in cluster headache, it would be only on one side of the head and that too only around the eyes. Okay, this is difference number one. Number two is cluster headache में the patient will also complain of running nose and watery eyes. Whereas in migraine ऐसा कुछ भी नहीं होता, उसमें केवल हेडेक होता है. जबकि क्लस्टर हेडेक में नाक में से और आंखों में से पानी भी निकलेगा और केवल आंखों के आसपास ही पेन होगा, पूरा फेस इन्वॉल्व नहीं होगा. फाइन. अलोंग विद इट उनको ड्रूपिंग आईलिड होगा, जिसको टॉसिस बोलते हैं. ड्रूपिंग आईलिड होगा, पेन अराउंड द आईज होगा, watery eyes and runny nose. So these all are the symptoms in cluster headache. And in migraine, there is one side of the head involved, including the face, or both sides of the head involved. Understood? Now, what are the trigger factors in cluster headache? Smoking, stress, certain foods, and even alcohol. See, now cluster headache usually occurs in older men. Okay, and the attack tends to come usually at night and it lasts for 1 to 2 hours. Now there is one more major difference between migraine and cluster headache. What is it? Migraine में repetitive attacks आते हैं बार बार. Whereas in cluster headache, after a series of attack, the person may be well for months. उनको एक दो बार ही अटैक आएंगे and then फिर महीनों तक he'll be as normal as as you and me. But migraine में कभी भी headache वो जल्दी trigger होता है, cluster headache जल्दी trigger नहीं होता है. All right. So this was about severe headache. Now what can we do to overcome the severe headache? So the simple measures which one can take is relax in dark room. Remember I told you that the person is unable to tolerate bright light in migraine. Fine. So the best measure one can take is to relax in dark room. Other thing is he can go with painkillers, that is analgesics. Now, what are the painkillers he can take? He can take painkillers like paracetamol, aspirin, ibuprofen. So these can help in relieve the pain. But always remember, guys, the patient should not take all these medications over the counter. यानी बिना डॉक्टर के प्रिस्क्रिप्शन के या बिना डॉक्टर के एडवाइस के मेडिसिन नहीं लेनी चाहिए. Why? Because they may cause hyperacidity. All right. So this was all about all three types of headache. जो तीन major type of headache है. Now let me tell you that there are other types of headaches also. There are other reasons of headache also. जिसमें ये वाला area head का, जिसको crown of the head बोलते हैं, parietal head बोलते हैं, वो involve होता है. So ऐसे कौन से type of ऐसे कौन से reasons हैं जिसमें केवल ये वाला headache होता है? Fine. So hunger, cold, कोई भी weather changes की वजह से cold, teeth problems, any premenstrual tension, blood pressure fluctuation, either too high, either too low, or any infection. The infection could be like either intestinal infection, brain infection, so कोई भी type of infection. So in sub causes में the area of ache is this part. All right. So this was all about the types of headache. Now the question arises that when should you consult a doctor? See, sometimes people take it very lightly. उनको लगता है एक headache ही तो है, जल्दी ठीक हो जाएगा, आज नहीं तो कल ठीक हो जाएगा. But no, this is not the right criteria. See, headache कब कब हो रहा है, कितनी बार हो रहा है, कितने दिन तक चल रहा है, headache के साथ साथ fever तो नहीं है, ये सारी चीजें यानी बहुत सारे symptoms होते हैं. अगर वो सब भी symptoms आपको दिख रहे हैं, then one must consult a doctor. Now, what are the symptoms? Let's talk about it. So number one is recurrent headache. As I told you, right? Bar headache hona. Recurrent means again and again. Headache along with fever lasting for more than 4 days. अगर 4 दिन तक headache है, fever भी है, तब आपको डॉक्टर को कंसल्ट करना चाहिए. Vomiting, confusion, if there is stiffness in the neck, difficulty in speaking or seeing, and tingling sensation. Tingling is जो हम बोलते हैं ना झंझनाटी हो रही है, that is tingling sensation. तो इन सब में से कोई भी सिम्टम या सारी सिम्टम्स हैं, so the person should go and consult to a doctor. All right, guys. So this was all about headache. So this was my brief note on headache. Please let me know in the comment box how was it, and you can even tell me that which topic shall I come up with next. All right, so that's it from my end. Subscribe to this channel, click on the bell icon, guys, for getting notified when I come up next with some interesting videos. All right, thank you so much.